Good evening, everybody. We hope you had an awesome weekend.
May is Lyme Disease Awareness Month, and as the weather starts to warm up and we spend more time outside, we thought we'd spend some time talking about Lyme disease.
So Lyme disease is caused by a small organism called Borrelia burgdorferi, which is carried by ticks. But it's really not the end of the story, since ticks can also carry, often, other organisms, including Bartonella, Babesia, Ehrlichia, as well as a few others.
Lyme disease is predominantly seen in the upper northeast of the United States, as well as the upper Midwest, where we live, but it has been reported in every state. And the typical initial symptoms are what you think of, but not always seen, with a bullseye rash and fever and perhaps some joint pain. However, in our office, we typically see people who are not diagnosed up front, and they have more chronic signs and symptoms of Lyme disease, which are weird migratory pains, aches and pains in different joints. They may have numbness. Sometimes they have a facial paralysis where part of their face is paralyzed. They can have headaches, unusual fevers that come and go, and often we see that it's a trigger for other things like autoimmune diseases.
Now, testing is not so easy with Lyme disease because, unlike a strep throat where you can actually swab the throat and see the organism under a microscope, the Borrelia organism is really difficult to isolate from the blood, and often it's in other tissues of your body, your joints, your muscles, the very things that hurt with Lyme disease, even chronically. And so we rely on people's ability to make antibodies, and most of the tests for Lyme are antibody tests. There are a few other types of testing, but many of them are not very sensitive. So we really have to rely on Lyme being a clinical diagnosis, which is what the CDC will tell you. There's no one test that can really 100% rule in or rule out. And in fact, the two-tiered testing that is advocated by a lot of groups actually may have a sensitivity as low as 50%.
So what do we do if we've been diagnosed? There is treatment. That's the good news, because that's often a concern that people feel like they'll never be able to get better, and that's just not the case. We see it all the time. But treatment is individualized. It is going to require that you do something to help kill the organism in your body, and again, that's a individualized treatment, and we recommend that you see your functional medicine doctor to, one, be diagnosed, and to get the appropriate treatment.
It is really important to see someone who's an expert who's dealt with Lyme disease before. So we hope you have a great night.
Take care. Bye.
Bye.